Fairly inexpensive. Yeah, they'll send you a proof, I mean, free sample, like of a hat.
Are we recording? Good morning, everybody.
Morning.
I'd like to call this meeting of Health and Human Services to order on April 30th, 2025. We have a quorum. First on the agenda, we would like to accept the minutes.
Second.
Moved by Supervisor Hall, seconded by Supervisor Wilson. All in favor?
Aye.
All opposed? Passes. I'd like to make a very quick insert into the agenda. Ken is here and he's got someone waiting downstairs with veterans. So he's got about a 2 or 3 minute at the most thing he would like to discuss. So.
Thank you. Good morning, everybody.
Good morning.
I promise I'll be short. Appreciate you sliding me in here this morning. I just wanted to pass a little bit of good news. I know last month was a little bit dreary with the personnel shortage in my office and everything. But within the last several weeks, been working with one of our previous deputy directors, Michael Alexander, who had been a mainstay with me for many years now, and pleased to report that at the end of this month, he'll be coming back.
Good.
And he'll be filling that deputy director position. And the office should be fully staffed and running pretty well at that point. That's all I wanted to pass, and if there's any questions or anything.
I'm glad to hear that, because he was a real go-getter. He's a great employee, great deputy director, and for those that don't know, he was offered a job with the state. He went to the state and for about $7,000 a year more, and he said, "Okay." Finally, he said, "This, I'm not being allowed to treat veterans as veterans and do what we need to do," and so he came back home, and we're better off for that. So that's a good thing.
So Ken, now that you're fully staffed, I can open up the pipeline to you again.
For sure.
All right, I'll keep pushing people your way,
Absolutely.
despite where they live.
I welcome it. I appreciate it.
Thank you. Thank you.
Thank you for the good news, Ken.
Thank you.
All right. Next on the agenda, we have Youth Bureau. Welcome, Sue.
Oh. We just have one agenda item, and that is in regards to the Rural Community of Practice Grant. From my perspective, I was done with, but apparently the grant ended. However, because we had subscription, so to speak, for the next, we have a training curriculum that goes into 2027, and we have another Atlas online program. We need to budget and move dollars into the 2025 budget.
I'll make the motion. Good. I think you're gonna move finance, right?
Yes, this has to go to finance, right? Say Supervisor Wilson, Supervisor Hall, seconded. All in favor?
Aye.
Passes.
Thank you.
Thank
And
you.
that's all I have. Thank you.
Thank you.
That was painless.
So Brian's running 10 minutes late. Maybe we can be done with everything. That's recorded. Oops.
Yeah.
All right.
As it should be.
I can't.
Right.
I have gifts for you all. I have tickets. Hopefully you won't need
All
them. but
right, well, I will be in the ditch this weekend.
So the first thing I have on the agenda is a few resolution requests to amend our 25 budget. The first one is to recognize revenue that we received from the Connectivity Self-Management Program. It's in the amount of $50. We do need to recognize that, so.
Motion with finance.
Supervisor Wilson, any seconds? Scott. Hahn. Supervisor Hahn seconded. All in favor?
Aye.
Passes.
The second one that I have is to move money into our equipment account in order to purchase 2 AEDs. And that's in the amount of $500.
Make that motion.
Seconded by Baker. All in favor?
Aye.
Passed.
The third one I have is to move money again into our equipment account. We're gonna be purchasing some furniture for the Burgoyne Ave site, out of one of our grants, and the amount there is $8,509.
I have a motion.
Make the motion for discussion.
All right, seconded.
A second. No, go ahead. Scott, you got it?
Well, the question is, so this is just transfer and
Mhm.
then, this is part of the master plan to move people around, right?
Yes, yep, we met with, Matt, and went through and he gave us, what our options were for furniture, so this is the money we can pull out of our grant to help with that.
Thank you.
Welcome.
Other question, when we procure furniture, do we always buy new or do we take advantage of a lot of the offices that hold on to very good quality furniture and reasonable discounts? Do we know?
We've done both in the past, depending on what's available out there. This would be for new furniture.
Discussed it, motion to accept. All in favor?
Aye.
Passes.
And then the last one that I have is to, again, move money for furniture, but this is for the WIC program. Again, they're moving over to Burgoyne, so they have $10,000 that they'd like to move into their equipment account for equipment. Or for furniture mostly.
By Han, seconded by Hall.
Does that money come from grant money as well?
It does. Yep, 100% from their WIC grant.
So any further discussion?
You'll see, you'll see different accounts, their finances, let you know. The accounts that are on the sheet won't be the accounts that you see in your packet of
Okay.
finance. That's a clerical thing, but I just want to let you know that these will be the accounts that you see in the final plan.
Okay, gotcha. Yeah.
All in favor?
Aye.
Passes.
The second thing I have is you were notified, I think it was last month I had brought to you, asking for permission to sign the letter of intent for the Children with Special Healthcare Needs program. We received another letter this past month, for additional funding related to that program, but it has to do with community accessibility and inclusion. So it's $30,736, and I've been requested to ask to sign a intent to participate form. So that would be additional funding for the first year of that grant, which would start 10/1/25 and go through 9/30/26. So just looking for permission to sign that letter of
I'll
intent.
move it.
By Supervisor Hall, Supervisor Wilson seconds. Any discussion?
Yes. So is this to be utilized in your facility or just to develop a program to go out to communities to encourage them to do this? Or
Yeah, so it'll be funding that's within our department, but we can use it for that purpose to promote that. I have not had a chance to talk to Matt from Buildings and Grounds, but one of the allowable costs there is accessible playground equipment. So I'd like to do something at the county parks, but again, that's preliminary and I haven't, like I said, I haven't had a chance to talk to Matt about that yet, but that's one of the allowable costs.
With this, when the funding ends, we keep it into equipment, we don't have to keep buying equipment, keep it in a program, that we expand services, or we building a future cost?
Yeah, that's why for this one, because it is just the first year of the grant, that I would like to do something that's just a one-time expense.
Okay, good.
It's all grant funds.
Yeah, 100%.
Then, all in favor?
Aye.
Passes.
And then I do have a couple program updates. We also, after I submitted the agenda items, we received notification from New York State Department of Health that they're amending our rabies contract. The 5-year or the 3-year that we were on ended 3/31/25. They've added a 2-year extension to that. So now we're going to be from 4/1/25 to 3/31/27. And the amount of that is $24,221 per year. So I'd just like to request permission for the chairman to sign the contract extension.
Yeah, any discussion items? All in favor?
Aye.
Passes.
Thank you. So as you've seen in the media, measles is continuing. As of last Friday, United States was at 884 cases in 30 different jurisdictions. Again, New York still at the 4 cases, 3 in New York City and 1 in Suffolk. So we're just keeping an eye on that. As you know, it's warmer weather, the ticks are out and about. We've been getting quite a few calls on ticks. So I did bring some tick removal kits here, so yourself to those. If you need more, let us know. Federal funding update, as of right now, we have 1 fellow within our office, who's not a county employee, but is stationed in our office. The funding comes from the Department of Health. It's through the fellowship program. That funding is, right now it's actually in the courts. I have not heard the results from yesterday's last hearing. But as of now, that fellowship program will be ending May 30th, which is a couple of years ahead of when it should have ended. So it does affect our department, but again, it's an employee that was not on our payroll, but was, part of our department through that program. So until, I'll keep you updated, they may extend that depending on what the results were from yesterday's court hearing. So more to come on that. And then due to some staffing changes, I'd like to request Susan Hunter to be part of our professional advisory committee. She's our infection control communicable disease nurse. Our previous person resigned from public health. So I was just looking for a resolution to add her to our professional advisory committee.
That's to the full board, correct?
Yes.
I'll move the motion.
I'll
second it.
All. Any discussion?
Is that, that's not a paid position?
No, it's just a quarterly meeting we hold with our medical director and several other people within the community.
Anybody?
Yes, Patricia Williams. Be coming off.
Any further discussion? All in favor?
Aye.
Passes.
And then the last thing I have is just a reminder, we are available to table, with all of our public health materials and educational items that if you have any community events. Sometimes we're just not aware of those. So if you want us there tabling, just let us know. And more than happy to try to work that out. And that's all I have.
Great,
Thank you.
I have a question. How you make it on your education for your certification?
Good. I'm in my last class. So, and then I have to
Great.
do a program over the summer. It shall be done in August.
Beautiful.
Yeah.
Congratulations.
Very excited about it.
Sure you are. Sure you are.
Tina, where you go?
Mhm.
How's the attendance been at the rabies clinics?
How is what?
How's the attendance been at the rabies?
It's been great.
Has it?
Yeah, we've had 2 so far, and they've both been just about full. We have a couple no-shows every now and then, but we just had our last one in Granville on Saturday, and then I think our next one is in Argyle, in May.
I was wondering about how that works. Does the appointments, are you having more than you did without the appointment, or is it about the same number?
I would say we're having more. I think it's good for people to know that they don't have to come and stand in line or, wait in line, and it definitely creates less chaos for us at the clinic because we don't have.
No, I wasn't anti, I was trying to see the numbers.
Yeah, no, it's been good.
I thought
Yeah, people really take advantage of it, which they should. So, yeah.
Saturday, though, the town barn was full Saturday.
Yeah, we've had good turnouts for sure. And people with multiple animals coming through. So, yeah, it's been good. Thank you.
Thank you very much.
At least out in the dark.
Next up, Office of the Aging.
Chairman, do you notice how that he trained us, joined a committee that he brought himself right to the table?
Hey, theoretically, he was correct. He is at the HA.
I was afraid that I was.
Yes.
He is at- I was afraid I was in the wrong place.
Did he need to be pulled back or did he recognize his error?
You know, he was advised by Dave.
Yeah. Dave couldn't wait to talk.
Supervision is needed.
It is, I couldn't wait. That's exactly. I know when I'm out of place. You have to be told.
I didn't like it. I said,
Hello, Tina.
Morning.
How are you?
I don't.
Doing well.
Oh, I have it. Sure, she has letters for the board members. I think she has one without a letter.
Oh, so you're doing your annual
Right.
report.
I'm sorry. He's trying to make me give this to Al and I told him no. No. I got your back.
Careful. We always get along.
So on that, I really thought that when I put annual report on the agenda items, that we would have a full house. So thank you.
It may have impacted.
I'm sorry.
It may have impacted attendance.
I was hoping it was the opposite. So first, I would like to start by talking about our OFA Advisory Council. At a previous committee, I shared that we had two individuals that are no longer part of our advisory council. And at this time, I would like to request permission to appoint Gail Barra based on the recommendation of Supervisor Clary. Gail will represent Salem on our advisory council. This is something that would need a resolution.
I'll move it. I'll second.
Any discussion? All in favor?
Aye.
Thank you. May is Older Americans Month, and our process has been in the past, is we accept nominations from Washington County individuals to nominate somebody who is a Washington County resident over the age of 60 who has tremendous contributions towards their community. We accept all those nominations throughout the year, and then the advisory council then votes on votes for two individuals to represent Washington County with New York State Office for Aging. When the voting takes place, all the identifying information of the nominees is removed. So that way, when the advisory council does vote, that it's done objectively. So in December, the voting takes place, and I would like to share with you that our two individuals who will be representing Washington County in Albany is Kathleen Comerit Wickham of Granville and Dale Lapointe from Hartford. So at this time, I'm seeking advice on how you would like me to proceed. In the past, in May at the full board meeting, I've invited our honorees to a full board meeting and done a short presentation with them there. And they receive a county pin from the chairman. I'm inquiring with, I'm sorry, my voice is like bubbling down all of a sudden. I'm inquiring to see if you still want that to happen in May at the full board meeting.
Yes. Do we even need a motion? Is that our practice?
If we do, I'll move.
No. Yeah, it has in the past, but it's been just, it was a recommendation. In the past, I used to have the honorees come to committee and do a little presentation. And it was asked to move that, that presentation to the full board for the community.
Does the press, various press also pick up these and do a picture or anything?
So we do
Really?
share the information. The information was shared with NYDT Media for Community Connections newspaper, which I had mentioned. They're going to be printing sometimes and printing not others. We are fortunate that in May, they are going to be doing a printed Community Connections that's going to be out to the community. That will go out to the community. In addition, I do let the media know. I'll send them information as well as our assembly people, our senators. I also share the information with them. And in the past, some of them have come to the full board meeting and have also attended the dinner in Albany, where all of the New York State honorees come together and they've been given special proclamations.
Thank you.
So that said, we are collecting nominations for 2026. The nomination form is on our website. So if you do know somebody who has made some significant contributions to your community, please go ahead and fill that out and send me the information.
Make sure you spell my name right.
I do miss the annual dismay from the Putnam supervisor.
I'm trying to pick it up, continue that.
What I've also done in the past in May is submitted a proclamation identifying May as Older Americans Month. And I'm curious to know if that's something that you would also like to happen as well.
Yes.
Yes.
Thank you. I'll get that to you, or the chairman signature. With the correct spelling.
No respect for people. Always want to show no creativity.
I did share with our supervisors that we are hosting an intergenerational event with Argyle School Drama Club and Student Council. Just a reminder that we are going to be facilitating this tomorrow evening at Argyle School. So what we do is we partner with the schools drama club and the student council. The drama club does a live audience rehearsal for their weekend. That's open to the community, and the student council serves. And so we have our meal planned. The attendance this year isn't as it has been in the past, and we're not sure why. But just giving you a heads up if you do hear about anybody talk about this. This is what it's tiring. So at this time, I'd like to present to you our annual report for Office for Aging. In the past, I've done a PowerPoint presentation, and at this time, I'm going to kind of go through a traditional way because I know that some people like going page by page through annual reports. I'm going to go ahead and highlight some pages within the report itself. You can start by talking about the front cover. As in years past, OFA and DSS seeks contributions from employees. We ask that they submit photos, drawings, or anything that really highlights Washington County. And this year, Becky Palmer, our county supervisor with 31 years of service, won the honorary status of her picture being on the front cover of our 2024 annual report. So what I'll do is kind of go through pages. Supervisor Baker, do you have one? You didn't get one?
No.
That's why I had an extra one. I'm sorry.
Thank you.
You should have called me when I refused to give it.
Oh, I was.
Here's the letter.
Even stole your book.
So if we can start with page 7. I feel like it's appropriate to start my presentation by speaking about the partnership that Office for Aging has with DSS. OFA and DSS have formed a partnership under a program called New York Connects, which makes our department an Aging and Disability Resource Center. And we use the term ADRC to talk about the Aging and Disability Resource Center. I'll be using the term ADRC and OFA interchangeably throughout my presentation today when talking about our department. Today, I'm going to focus primarily on the programs and services that OFA takes ownership of. Page 10. On page 10, we're showing you the OFA funding and reimbursement chart. OFA is supported by state, federal, and local funds, and also by a few grants. New York State Office for Aging is our official state agency that provides us with all of our guidance, and they are our central funding provider. The top of the chart shows the state and federal funding sources. Under the Older Americans Act, we are required to seek contributions for certain programs we provide, and this is included in the program income line. The county funding line also includes county local match requirements, as well as additional funding for our senior transportation and restaurant dining programs. The OFA program expenses chart shows the name of our state, federal, our grants and our county funding sources. The expenses column includes areas like payroll, maintenance, travel, and contracts for actual program implementation. I'd like to share that in 2024, we did spend 100% of the awards given to us. The reimbursement column reflects percentage of allowable reimbursements. OFA is not able to get reimbursed more than what the funding source dictates. And I've mentioned in the past, every funding source has its own guidelines and rules. Just like every funding source also has its own local match minimum requirement. If you'd like me to ask if there's any questions after every page or just continue on? Okay, thank you. So we'll move to page 11. As I mentioned earlier, that New York Connects is the main program that creates the partnership between DSS and OFA. The collaboration between both of our departments is successful in providing a one-stop location for addressing the needs of our community members. Our co-location of staff and the training that they receive from both DSS and OFA and their respective state agencies gives all of our staff the knowledge they need to provide well-rounded services. Please know that our departmental structure and that we have this partnership between DSS and OFA is unique across New York State. This page gives us the core functions of our New York Connects program, to include information and assistance, which is the foundation of our call center, public information, which includes our Community Connections newspaper, our long-term care council, which is shared with Warren and Hamilton counties, and option counseling, which is provided by our Boston University trained caseworkers. On page 12, oh,
How many
sorry.
calls do we get?
We'll see that. We got some great graphs and pie charts.
Great.
On page 12. The next two pages, pages 12 and 13, break down the information and assistance function of New York Connects. The information provided chart, which you see on page 12, on the top, shows our 2024 data. The purple graph bars and the purple graph bars. You can see that our information specialists provided information about health insurance and benefit plans to 1,810 people. This is an increase by 452 people from the previous year. Second to that was information provided on home-based services to include home modification and repairs, which was provided to 1,353 individuals. On page 13, the top chart, which is the New York Connects information requested, that's when people come to our office with a specific purpose. The information requested chart shows why people presented to us, and you can see that the pie graph on this page is in sync with the bar graph on the previous page. People presented to us mostly with health insurance and community-based services being their top information requested. Below that is the information for the assistance provided graph. This is more of the work that's being performed by our information specialist. The data shows that in 2024, our staff made 2,651 referrals for internal services and connected and linked 2,519 individuals to outside resources. The bottom of the page is just a simple breakdown showing individuals 60 and older that we served and 59 and younger, the source of our contacts, and also the mode of contact. And as you can see, telephone contact continues to be the main source of contact. So just to emphasize that New York Connects is a program, why it says 60 and older, 59 and younger. New York Connects is a program that serves all ages and abilities.
The one thing that I see on excuse me, these two pages, the surprising is the transportation request have dropped by almost 50%. Is that reflective of something good that's happened? Is the CDPA a lot better, or is any feel for that? That just seems like an interesting. I think of transportation is one of our biggest problems. I would expect that to keep going up.
So certainly,
Fine for the past 2 years, now it's dropped right now.
certainly, so as you know, the transportation that we provide has, the sources of transportation that we provided as a community has maintained the same. So in the past, it could be that people weren't knowledgeable of what was available. Now people, this is a complete hypothesis. People probably know what is available and don't have any further questions. It's not in any way reflective to the fact that transportation isn't a need. We do hear about that, we do have those conversations, but it may not be the reason why they came to us for information.
Maybe they're solving the problem.
Could very well be.
Or maybe once they've gotten the information, they're using the services, don't have to call again.
And networking to other people.
Yeah.
So it just, yeah, but that was the one thing that jumped out on both pages there. Transportation.
Correct, and that is the one, I love data, and so when I look at that, it does make me think too. So I am not surprised by your question because I asked the same thing.
Okay. Thank you.
So my question is, I'm going to contact. So if a person makes a phone call, sets up an appointment, does that count both columns? Phone call and face-to-face?
It would be how they presented to us. So it would start with the phone
The phone
call.
call.
Correct. Good question. Is there an extra? I think there might be an extra one that Dan, you're looking at it last year. Sorry, that was last year that I brought. It's good you to get treated. Sorry about that. I'd like to turn the page to pages 14. So 14 through 16 continues to share information about our New York Connects program. And at this time, I'm not going to go into any further detail, but do ask that if you have any questions about the information presented, let us know. The next couple of pages do go into the core programs that New York Connect provides, like the New York Connects Resource Directory, the public information that I spoke about, and the options counseling, as well as the long-term care council that we partner with Warren Hampton.
Do we provide respite services for family, like long-term care, family provider?
That's a very good question. I could answer that now, or I could talk about it more when we get to that section.
Oh, I don't want to jump ahead. Go
It's
ahead.
there. I've got some great data on that as well. Yeah. The fact that you use that terminology with me makes me smile. Yeah, I love it when people know that we provide respite, so thank you. If we can go to pages 20 and 21, again, I'm going to skip over some of the programs and services that we offer. I didn't see any major data reflection in those areas, and I know that public health also talks about the Tai Chi program that we partner with. So if we could go to page 20 and 21. These pages talk about the innovative ways that we battle against social isolation and loneliness. I'd like to highlight how one of our companion pet recipients, Helen McCure of Granville, was interviewed by Spectrum News in 2024. And so I do believe that I sent a link, and I'm not sure, Sandy had a little bit of difficulty accessing the link, but I did wanted to bring forward the video, the news highlight that Spectrum did with Helen.
That was at the time, because it seems like I viewed that before.
That's very possible. Yeah.
We did see it before.
We did.
That's what I'm thinking.
Did see it, everybody here saw it, so we can move forward.
Yeah,
So Debbie,
Send
no
it on
worries on
email.
that. How about the GoGo transparent for transportation? Is that forwarded as well? With Sally
I remember
Rahosa?
hearing about it, but I don't know, I see it.
Yeah. Yes. Yep, so our LEQ, we still distribute LEQs, the companion pets, which have been amazing. Have amazing for people to see like their face when we share those with them. On page 21, we do have staff that are dedicated to what we call telephone reassurance. And again, that's just something where people, it's a voluntary program, if people are feeling lonely or socially isolated, they can sign up for this program. It's offered with no charge, and they can, it's just simply a phone call with the individual talking about how the day, what the weather was like, or whatever is highlighted in that slide.
I have a question.
Sure.
Just so for the,
I see you're on page 22, right?
yeah, 23 actually.
Okay.
And you've got that on the other one. So were those, would these articles referred to by Spectrum News as a, did they find those to report on themselves, or was it something that we did internally to have
Seek them out?
To seek them out.
They sought us out, and the reason being is that Greg Olson does, Greg Olson is the director of the New York State Office for Aging, and he does a lot of monthly like Facebook Lives and talks about different programs and services. And so the state and ISOPA reached out to us on behalf of Spectrum. Spectrum wanted to do media, article, a video interview with individuals who are recipients of like the Candy Pets and the Ogo Transportation, which I'll talk about next. And so New York State Office for Aging reached out to us because we do a fabulous job in Washington County. And of course, you know, having Helen McCura be a recipient of one, and her interview was just incredible. I think she's now, I think last year she turned 11. She was 101. I think she's 120 now.
I don't want to,
Yeah.
she's.
And she's amazing.
Thank you.
You're welcome. So that kind of goes into the transportation services. Pages 20, 22 and 23. Transportation, as I mentioned, Supervisor Hankey, transportation for many of our rural Washington County older adults is still challenging to people. Our office provides transportation support in a few ways, to include through a contract with with the Senior Center of Kingsbury and Fort Edward, through a contract with LEAP. Shelley has talked about the data on that program here at committee, and through our partnership with DSS. We also offer a non-traditional transportation service through New York State Office for Aging called GoGo Grandparent. This is a service that utilizes Uber, Lyft, and taxi cabs. Often, actually, recipients will come present to our office. We will screen them and register them, and then they are able to use GoGo services 24/7, 7 days a week. In 2024, one of our GoGo transportation recipients, Sally Raposa of Hudson Falls, was interviewed by Spectrum News. I'm hearing that maybe, I see that it's up. So
But she's a social butterfly, and right now she's calling her ride to the grocery store.
I like to visit family, and I like to be able to get around.
Press 1 to request a ride.
She uses a service called GoGo Grandparent. It's a rideshare program geared towards older adults, and it's available in almost every county in New York State. You call their phone number, they connect you to a driver, and give you all the information you'll need, like the driver's name, plate number, and arrival time. And Sally says the best part? The rides are completely free.
I live on Social Security, and I have a small retirement, but it's not enough, and I struggle every month. So if I had to start adding rides into that, that would just be, I wouldn't be able to do it. Here we go.
GoGo has provided around 1,100 rides to New Yorkers since their partnership with the Office for the Aging began in 2023.
Oh, some chicken rice.
They do work with other companies for the rides, like Uber and Lyft, but there's a difference booking through GoGo instead of other rideshare apps.
Why we partner with GoGo Grandparent is they train the drivers in the unique needs of older adults, and that's really the difference. So you could do Lyft, you can do Uber, you can do GoGo, but if you get a driver through GoGo, they're going to be uniquely qualified to help an older adult.
Helping people in their third age like Sally.
Here we go.
Stay independent. Erin Kotel-Altman, Spectrum News.
highlight of GoGo, and I could share with you in 2024, we provided 314 one-way trips using the GoGo service.
Who provides the services in the other programs? Correct.
The other transportation programs?
Yeah.
So on these pages, I did my best to break out. So the top page is where it says ADRC Transportation. That's through our partnership with DSS. So in our office, we have 2 individuals with the title of community services workers, and they provide transportation services based on needs. So they help with like foster care visits. If somebody needs to go pick up medications, if somebody needs to go to Albany and sign up for Social Security, they help with a wide variety. If there is nobody else to help, that's the other piece. So we do screen individuals, and if somebody is deemed as they truly have no access to any kind of transportation, they can use the ADRC transportation services. That again is all ages under the New York Connects program. So with LEAP provides our older adult transportation services. So Washington County residents 60 and older. Through our contract, we pay LEAP to provide that transportation service. And as far as the other contract is with the Kingsbury Fort Edward Senior Center, they provide transportation to their site for individuals. They also do trips and grocery shopping services as well. You're welcome.
Gina, did I hear you say that they provided one-way trips?
So we count all of our transportation in one-way trips. So for instance, if somebody calls up and needs a ride, and they need to go to the pharmacy, the grocery store. So like the ride from home to the pharmacy is one-way trip. From the pharmacy to the grocery store is one-way trip. So that's 2, that could be 2 based on that.
It's really a round trip. They bring them home, they don't carry to the grocery store.
So if a round trip wouldn't be just counted as one trip. It would be like from point, from home to pharmacy, from pharmacy to grocery store, from grocery store to home. So that could be 3 that are in 3 units of service. That's a good question.
Is that because ride shares are usually one way? Like they might leave and
they would
person would have to order another ride to get to the next thing.
Correct, yes.
What's interesting about that is that something shows 300 trips, it can really be 100.
Yeah.
The number looks, higher than.
Correct.
So when Leaf says we provided 300 trips, it could be as low as 1.
That is correct. And how they define their unit of
Of
service.
course.
When they provide it
I
to
mean, it's
us.
like to know that.
That's why I asked, yeah.
When we start talking in
Yes.
numbers,
Yeah, we do
that,
break it
that
down.
300 isn't really 300.
Right.
It's worth the question to see how they present it. I know when we get the data from them, we just ask that they break it down. And that's just reflected here. Pages 24 and 25 highlight caregiver support services. So when you were talking about respite, my question would be to you, like, is the term of, are you looking for caregiver support respite? So we do offer that through our caregiver support services funding. We also offer the physical support, like the respite that you mentioned, daily tasks, could be helping with meals, chores, and we also provide companionship, as well as case management services for caregivers. So on here, when we talk about respite, we use respite in various ways. You can see in the gray column on page 25, it could be the personal care services, which is broken down into 2 levels. It could be consumer directed, which is where somebody manages their own, so that caregiver could manage their own. They may know somebody that's not part of an aid agency. They can bring that person in, use our fiscal intermediary services, and then be able to provide that respite as well. And social day services is also considered a respite. Again, these numbers are focused on the caregiver themselves, the caregiver needing that support. We do contract with different home care agencies for the level 1 and the level 2 respite. At this time, we do have, so I'm going to move on and talk about our home care services, but I should emphasize with you that the numbers are what they are because the funding is what it is, right? So we do have wait list, for services because we're not getting the amount of funding to be able to serve everyone. So if you're looking at the numbers and you do have a question about the data that's provided, that could play into it. Well,
What is a definition of a unit of service?
unit of service, when you're looking at personal care services, and consumer directed services is 1 hour of service. And my apologies, usually we do write that, we do define the unit of service and what that would be. So yeah, so in that term, it is hour of service.
Does any of that include like, today, somebody steps in and the caregiver regains some sanity?
So we do not offer that through our office. We don't, would I love to? Yes. But our funding doesn't allow us to open our services up to that array. We work with a couple of different agencies, the SUNY Plattsburgh Alzheimer's Initiative. They are funded for something like that. They are able, so when we do have somebody who needs that respite so our respite, again, kind of reflecting on that, that could be anywhere from an hour to about 4 hours a week, and it's based on the need. With what you're talking about, you would reach out to the Alzheimer's SUNY Initiative and see if they could assist the caregiver, as well as Lifespan. So Lifespan is out of Rochester, and they also have funding where they're able to provide that multi-day. On 26, I'm not going to go into great detail, but just let you know that the ADRC supports DSS with the case management services over the Medicaid home care program. And also the Medicaid personal response services that are on page 27. OFA also provides personal emergency response services, just like Medicaid. OFA services are non-Medicaid. They're provided to individuals that aren't eligible for Medicaid, but are in need of the service and have financial challenges to be able to afford the service. So that unit of service you can see in the box is defined. You know, so a unit of service there is the 1 unit per month. On page 28, I highlight a little more of the personal care services. So I talked about the caregiver respite where it's the same thing, level 1, level 2 personal care. With the OFA personal care services, this is for the individual. So the individual may not have a caregiver, but they're in need of some assistance in the home. This service, the main goal of providing it to individuals is to be able to give them that support that they need so that they can maintain living in the community, that they can stay in their home, where they don't have to go into that higher level of care like an assisted living or a nursing home. The data for the past 3 years doesn't really show any great reflection. And as I mentioned earlier, a lot of it is dictated by the funding that we get. We do have a wait list for personal care services. What remains surprising is to see how this last year, we did see a difference in consumer directed in-home services. I'm surprised. If you look at the chart at the bottom of the page 28 on the left, you're going to see that over like the last 3 years, the number of consumer directed individuals has decreased tremendously. And so I, of course, am curious to find out why. And what I'm hearing is that individuals are having a difficult time finding individuals to support them. So in consumer directed, and that individual be able to manage their own care. They fire their own aides. They have more control over what's being provided to them. And here, for sure, it's disappointing to hear that they're not able to find people that can help them. And so if that's the case, if somebody has a difficult time locating somebody a support person that's willing or able to assist them, then they, of course, would be offered the traditional personal care services, which is through the agency. On page 29, OFA provides support through our contracts that are listed below with Holbrook, Port Hudson, and Danforth for social and medical adult day services. Pages 30 and 31, this is another area where OFA partners with DSS for the oversight and case management of adult protective services. The chart on page 30 is intriguing to see the referrals that we have that our office had seen. And so the highest referral that we have seen was the allegation of financial or other types of exploitation. And you can see the highest risk level for individuals is mental illness. Page 32 speaks about two of our contracted services. We provide, OFA provides legal services. We contract with Legal Aid Society of Northeastern New York. This is where somebody presents to us and is in need of a will. They want to seek assistance in power of attorney services. Our partnership with Legal Aid allows them to get that service. And again, we offer our services, all of our services, the majority of our services free of charge. And we ask for, under the Old Americans Act, we ask for contributions that I had mentioned back on the county page. We also work with the Glens Falls Association for the Blind and Visually Impaired for services for the blind and visually impaired. Our biggest program that we're known for is our nutrition program, and that is from pages 33 to 37. And so I'm just going to kind of just go over some data on that on page 33. We speak about the home delivered meals program. We also provide congregate meal sites, our mobile meal site events, restaurant dining, nutrition counseling, nutrition education, and our senior farmers market response program.
Just a point of information. Most of this picture, I think Jimmy McDougal, the drivers might be our oldest county employee. That might be something you might want to look into it. We could mention it at the board meeting. I believe Jim is our old meeting. By 4 or 5 years.
I'm making note of that. Thank you. Yeah, Jim is one of our part-time drivers.
Yes, that means he's in place.
Very dedicated. Yeah, it's amazing because like I say, that a lot of our individuals who help our nutrition, support our nutrition program, our part-time and per diem staff have worked full-time jobs and come back and help us deliver meals and help support our nutrition programs. Commendable.
I'm gonna back up just one step, it just dawned on me. So we're talking about the transportation, the medical transportation. That ways. Is there anything that is coordinated with let's say veteran services? Who provide medical services for our elderly to go to that rolls in so we could have a look at what we actually provide to the seniors? Because it's to the veterans, but it's they're senior citizens in most cases that you're taking.
I have to say, I appreciate you asking that because we couldn't necessarily operate a transportation program without collaborating with other agencies or departments. Veteran service is top on the list. So when somebody presents to our office, we're always screening first, talking to them, first seeing if is there anybody else that can assist or able to help. If the answer is a no, and they really truly need the support, then we would ask the questions, are you or your spouse a veteran? Not only with veterans, but we work super closely with the Conflict Center. The Conflict Center is out of Glens Falls, and they provide transportation services with a 20 or 25-mile radius of their office. We work with them very closely, same thing, and also with RSVP. So RSVP operates a volunteer-based transportation program, and they used to have a significant presence in like the Greenwich area. And so we would work with them to try to link them. So we go through those streams. Those are kind of those streams first, and then narrow it down to our service if we really can't find somebody else.
But that doesn't give us the numbers, right? Those are
Correct.
Those aren't accounted for.
That is
And it
true,
doesn't
because
give
we
us a true-
don't,
It doesn't
yeah,
give us a true picture of all the services that are provided for the seniors, because we don't capture those numbers. They're done by another in-house agency.
we would capture it under New York Connects. Yeah, so they would call our office, if they called us, or if they called Lead. I'm not sure how Lead would capture that data, but New York Connects would be absolutely, because that's the starting place whenever somebody presents to us, it's to our call center. So when they present there, that's how we would click those boxes in our New York Connects database, and that's where you would get that.
They refer there at that point in time. I just trying to understand.
Yeah.
No, when you click in your system, they go to veterans. We just assume that the service has been provided, or we actually capture the fact that it was.
So we would ask the person. So we would capture it as the person presented to us with questions, and we would put that in there. If they said, well, we're not, if they needed a warm handoff, we would absolutely assist that. We've had staff a lot of times walk them down to veterans to have that conversation. So the outcome, I think, is what you're looking for, right? Because you're looking to see, like, we made the referral, they presented to us and they asked the question. No, we wouldn't necessarily know that.
I was just looking to see that, and I'm just saying seniors, that's what we're talking about now.
Yeah.
But to see what number of services are actually provided to the seniors in Washington County by all the agencies. Because I think that's a big number that we don't capture anywhere. I just thought of that when I was sitting here, because I know when I was director, we never, we worked together.
Yeah.
But they never knew if we actually transported people and how many of them we actually transported were servicing seniors, and the numbers of times they might go to the facility. Just thought.
On nutrition. So just to kind of go into some data, we saw a slight, which is interesting, we saw a slight decrease of people served and meals served for the home delivered meals program. So we saw about 40 people less and 281 meals less last year than previous years. Speaking about the page 34, the dining sites, the congregate meal sites, and pop-up events, we saw an increase, saw a slight increase again, 20 people, 22 meals at the sites. And restaurant dining, which was surprising, to see the data there, is that we did see a decrease of 11 people registered and utilizing the program, which totaled to a total of 278 decreased restaurant dining meal tickets turned in. I'm not sure. When you say cost, we don't, it's not, we seek a contribution, a voluntary
Right,
contribution.
But the coupon gives them so much off, so the total might be bigger, is that?
We did restructure this year.
Yeah,
Last year, we.
okay, so that is in
Last-
place, yeah.
Yeah, so last year we saw some restaurants kind of, I want to say, were kind of going rogue. They were
Yeah.
using it as a coupon. And that did happen last year. This year, we redefined all of that because it created a whole lot of confusion. So this year, they're not able to use it necessarily as a coupon or discount. The the restaurants each have to provide us with a set menu. So that way when people participate in the program, they know when they go there, what to expect.
So how does that work?
I haven't heard anything negative. At this point, the restaurants have been very cooperative, thus far. We did have one restaurant this year, terminate their agreement with us, that's Sally's Hen House. And the reason being is it was too much to keep up with the tickets and turning it in. That's what I was told. But it was surprising because restaurant dining is unique to Washington County. And when I perform the public hearing, which I'll talk about later on, usually that's the main topic people love to hear about. So going through the annual report, pages 38 to 44. I'm not going to go into detail on those pages, but they just simply talk about our senior center recreation program, our intergenerational event that we partnered with Argyle School, our senior picnic, the collaborations that we have with other organizations. Page 31 shows our unique emergency support systems that we offer, the outreach we conduct, public information, and of course, ending on page 44 is the advisory. I'm looking.
Well, your chairman has an opening, so I just didn't think that one good.
Let's see.
Salem was filled last year and was passed, but we just filled that one. And I want to say Granville is now open. So the ones that are here that are open are still open with the addition of Granville. And Supervisor Baker and I have been working together to individual identify to see if that person.
We can collect those that can do you.
Yeah.
I think it's important to your group.
Having representation from every town is very important. Very important.
It's really the best way for it now.
Correct.
Let's go to
I explained this role as the kind of like the liaison between the community and our office. So, when they're identified as coming to the council, I provide all the information, like they know, they don't have to know everything. They just can come to us with questions, but they can at least help people to guide them our way. So, it's really important role.
Has she reached out to you at all?
I have not heard from her.
All right, I'll swing down through and see if I can make contact.
Thank
with her.
you.
I will tell you, the town of Fort Anne, the message you put out at your meetings, advisory council is taken seriously by Commissioner Scott, who's on our board. Every board meeting, she does at least 15 minutes on, as I go around to my board members, talking about the things from the advisory council that you people have discussed out there. So
Glad to hear.
she does a good job.
And that brings to point that, everybody plays their role differently. Gretchen Stark is on the town council, so she fortunately, and like truly appreciate, brings the information from our meetings forward to the communities through town board meetings. Not everybody has to play that role. It's however, whatever works for them and the community that they serve.
Police Advisory Council.
So I would take recommendations from you. So if you know somebody in the community that you feel would be perfect for serving on the council. I also have people approach me and my staff. And when that happens, then I would come to you and say, mention to you that the individual approached me, they're interested, and really make sure that we're in agreement before having them appointed to serve on the council.
Thank you.
Must commend you on this, because you spelled Meadowweed right here. The state of the earth insists on an O being an A, but it isn't, it's an O.
Good to know.
You hit it right nail on the head.
Page 45, I mentioned to you earlier that at every public hearing, people talk about the restaurant dining program. This year, I did the public hearing a little bit different. I provided what I call a needs assessment to participants and asked them to fill it out. And we also had a great discussion around needs in the community. So the chart that you see here, that was information that was collected at that public hearing. As you can see, we had about 175 older adults present for the public hearing. The graph on this page shows how older adults range their highest needs, what they thought was the highest need in their life or in their community. As you can see, assistance and support for home modifications and repairs ranked the highest for our residents. That's not shocking to me. I've heard that in the past at previous public hearings or focus groups that I've gone out to. In those cases, we have access to limited programs that are out there that can provide home modifications and repairs. Rebuilding Saratoga is an organization that holds a grant that serves Washington County. That can help people who are income eligible with home modifications and repairs. So I am going to allow you to finish viewing the report on your own. I will certainly want to thank everyone for their support and your attention. Certainly, as you can see, completing the annual report is something that we do not take lightly. My staff do a tremendous job. We work together, spend a lot of time collecting the data, creating the pages that are presented to you today. So I will be placing the link to the annual report on our website. So most certainly, if you have time, you're able to look through this. If you have any questions, let me know. Please refer people to our website to access the link. And most certainly, it's again, want to say thank you.
I would say thank you for the great job you've done.
Yes.
Keep my calendar.
Just one last thing. I think that you're faced with a lot of questions from your constituent. For sure, use this as a guide, like you can share it with your community members, with people that have questions, and see if we are able to provide support or answer the question that you're seeking. It's multi-tool. I hand it to our advisory council members and say the same thing. Use this as a tool. Thank you.
Thank you.
Thank you.
To right or wrong this moment and provide the first copy to Supervisor Baker. Yes, that's report.
Oh, thank you.
Sorry.
It was all Brian's fault. He
Yeah,
started
yeah.
talking.
You're welcome. So there are certainly should be enough copies here to share with everyone. The piece of cardstock that I'm sliding down is what I would intend for us to focus on during our conversation at this time. But I also have the full annual report. I don't know if I, you got it, okay. Did I pass these? Yeah. Thank you. And good quality.
Safer.
Yeah, I'm gonna say that's more about, purchasing.
Bus is over there.
So there's two sides to the card stock that I provided you. Most of the information that's on either side is in the actual, annual report supplement. There is a bit more detail in some of the areas that are on card because I wanted to be able to, have a more full conversation about them or answer questions if you had them. Would you like to start on this side? Start on the
Yes.
finance side? Okay, so we'll start there. This provides a 5-year look back with some explanations, some added explanations with the asterisk around the revenue that is shown. The note that's down at the bottom, not all reimbursement can be projected based on the rates published by the state. It's complex calculations behind the scenes within our claiming system. Calculations are dependent on multiple factors to include the client's eligibility, the case counts, whether that's capped funding, and any allocation of the expenses based on data that is actually supplied through larger counties, by the way that the system is created within the state. So when we say that, and have said in the past, that the overall safe number to consider for DSS in specific purchases is 75%. It is an oversimplification of our claiming. There were no changes to any of our claiming reimbursements in 2024. They all remain the same. What changed is which of those areas we spent more in. And so when you spend more in a lower reimbursed area, your overall percentage of reimbursement declines. And that is what we saw happen in 2024. I specifically pulled out with these charts, the programs of foster care, Committee on Special Education, and Safety Net, because those were our very high, the things that threw us for a loop really with our budget in 2024. So they're specifically shown there with the look back. In the area of special education, we receive a 43% reimbursement. In the area of safety net, we receive a 29% reimbursement. The years of 21, 22, and 23, where the percent of program revenue is in the 80 bracket, were years where we received a great deal of federal funding, generally associated with ARPA or the funds that came as the result of the pandemic. There's another large number that shows in the line of equipment in 2022. And you'll remember that that was a year we were able to pull down funds and do a lot of modifications within the county building, within any area that was attached to social services. So for instance, these tables, chairs, and screens were all purchased through that funding.
Commissioner, the additional cards that we bought through the ARPA funds in that number as well.
It is, you're telling me it is? Okay.
I'm asking.
I
would think it is.
I would bet it would be a such.
The OFA vehicles,
Would be, I think.
it certainly may well be, or should be. It's somewhere in those numbers.
Timing is right?
Yes. Foster care also reflects the cost of adoption. When we pull out this line for foster care here, it is really a reflection of 3 or 4 different appropriation accounts within the overall DSS budget. We isolated the payments that are made specifically for foster care, reflect that here.
So that was a huge increase though, in 2024.
Yes.
50%. And what
In-
is reimbursed?
The foster care adoption went up by $518,000.
Foster care went from 2.4 to 3.7.
Expense of foster.
Is it?
Yes, but I thought that I had done the math on that. It came out with $518,000 difference. I
Maybe.
must not, perhaps didn't do that accurately. Guess not. Yes, and so that really, back again to the discussions about there not being sufficient resources within the foster care system to find placements for the children. And when we do find the placements, they are further away, they cost more, they may be out of state. We have another youth right now in a place that we'd had one in the past where they say they will accept the child, but then they view the child as having extreme needs and they want us to pay for an additional one-on-one rate for each day for 3 months, which is $1,200 a day. I watched it like a hawk with the first kid and wanted to monitor how the functioning was. And then I pushed on, we need to end this rate. And they gave us a 15-day notice promptly after that to move the kid. So it's that kind of a system that we're working with to try to find caregivers for our most needy and vulnerable children. The number at the bottom of the 24 column for the county Medicaid cost, $11,459,000. To draw, I guess, another perspective on that, within our supplemental report, it reveals that the amount of money that is then paid out through Medicaid on behalf of the Washington County residents that receive Medicaid is $164 million. So for our residents receiving Medicaid, that is how much money gets spent out, whether it be to hospitals, nursing homes, ambulance services, therapies, that sort of thing.
And that's our full cap number now, or?
No, that is separate from the cap number.
No, I mean,
Oh, I'm sorry, that is,
that is our cap number at the moment, or are we, one more?
I think we had one more increase, Brian.
I think we do have one more coming.
I think we may have just done it.
11.6, right? I think.
We just had one in April was the final.
Right.
Yes.
But I think it takes us to 11.6, I think is our actual cap.
Even 25 won't show your full cap number.
Right.
You get 3 months at the semi-reduced rate.
Yes.
But I will give the commissioner a lot of credit because she came to the budget officer and I with an opportunity to spread some of that load across
Oh,
the
it really
24 and
helped.
25, and it really did.
Yeah. And then your percentage of program revenue has OFA in there, so that's why my numbers look different than yours. Because OFA is a smaller amount of money, but it's a bigger revenue source. I think we can sell 78% in yours, and so I think I have 62 for DSS. So the average will combine to 60. Yeah. So,
Still a drastic decrease.
It is. It is, but it is not, this, in the past, the state has changed things for us midstream. They did not do that in these areas this year, or in 24, it did not happen. So when we look at it, it is still the same reimbursement rates regarding whatever program it is. It's just more a depiction of where the need is. And those areas don't have as great of reimbursement.
and the state can change monthly or weekly.
They generally will introduce their changes and pass it through with the state budget. So we only have very preliminary information right now about what has happened with the state budget. I don't have anything that
Biography,
gets
for sure.
into the weeds on
That's
that.
how it works.
Another thing that has not really been a focus in the past, also on this side of the page, the social services county partnerships. See that down in the bottom third of the page on the right. And so we talk at different times about the funding that is administered, like within the youth bureau. The IT component, the sheriff's department, but this pulls together so that you see that also through the DSS budget, that overall picture that you're looking at up above is over $500,000 is going to other county departments. And the reason that we do that is because of that reimbursement rate. If there's services that the county needs to provide for its residents, but can do so by pulling better funding through DSS, it is better to do that through those cooperative agreements. And that's how we are better able to meet our needs. We did not include in this the vehicles that get purchased and then would be transferred over eventually to the fleet. There's maintenance in lieu of rent. We also do transfers of other items throughout the year. So it's not an all-inclusive, but these are things that are easy to grab onto and reflect. Any other questions on that side at this point?
So just so I recall, the 11.5-ish million, which is now a little bit higher on the Medicaid cost. Medicaid dollars
164.
is what Medicaid spends in our county.
That 164.
164 million is how much our county receives of Medicaid. We share to 11,600,000.
The state capped what our share was years ago, and then we would get EFPAT money and whatever to bring it down, and that's why you can see the changes. Because our cap number's been the same right along, but it's always been brought down, and then the state decided not to share anymore. They didn't like sharing. And
So the 164 is a combination of federal money, state money, and county money.
There's
Yes.
a push now
that's the biggest
federal government
concern, yeah.
to have the floor number changed for the feds, which will push a higher cost share to the state, which makes me nervous.
Because
The
the
state
state will change.
the state traditionally doesn't take increases well. They like to pass them on.
So
But there's a push right on the federal level to shift the floor number.
if that cap changes, all guesses are.
So the other side, I have sometimes not included or brought out with a big reflection on our legal. This year I wanted to do so, if for nothing else, to certainly share with you the very bottom box in that legal category, the number of new adult guardianship cases that came through us in 2024 were 7, and none of them were applications that we ourselves filed. So we can be involved and brought into the picture to provide a large amount of service when there is a member in the community. They may well be in a nursing home even, but because they themselves are not able to pull together their financial documents, or there's any number of situations, properties that are left unattended, things of that nature that then can be filed and say that a guardian is necessary to be appointed. We then do everything we can, and this is one of the aspects that happens through Gina's office, do everything we can to contact and find other family members or friends that could serve in this capacity for the people. But in the absence of that, that is when me as the commissioner of DSS is appointed through the legal process as their guardian.
Long story short, it's usually somebody's in a nursing home. Nursing home's not getting paid by resources of the resident, and they usually file petitions to us to make us the guardian so that they can get Medicaid and get paid. That's the long story short.
Right.
No, a higher number, 'cause it's not a huge number, but is that big compared to what it usually?
So this is how many petitions were filed, right? The 7. So our overall number of guardianship cases is, I think, for the years, still averaged out at 8. So at the close of 24, we had 8 that are officially I am guardian for. There is play on that through the
But I
year.
mean, have you ever been as high as 20 or as low as?
God, no.
That's what I mean, that
Right.
kind of.
No, and
In some, usually, Tammy as a commissioner is by law kind of the option of last resort. So we're always trying to find, yeah, I know, sorry to believe, family members. We have one, we just got assigned to a woman in Essex County, at least on a temporary basis, because, you know, unfortunately, part of this is my fault from the case that we won against Saratoga County. If the person enters a nursing home and their last residence was in Washington County, they are still considered a Washington County resident, even though they may be residing in a nursing home in a different county under the social services law. So this unfortunately was the first time that I kind of got pushed on my own petard. In that case, I had a appellate division.
In that situation, the woman had been a resident of Essex County, came to stay with her son, who said he was going to provide care for her. He was here briefly enough. She was here briefly enough before he then dropped her back off at a nursing home, saying it was gonna be respite, and then he never went back to pick her up. And he also is alleged to have pilfered many of her resources, and so that's a pending situation that we'll be working on with the sheriff's department and the DA's office as well.
So when there are assets involved, does that mean that the county has to manage those assets as well?
Yes.
And if no assets, does the county foot the bill?
Yes, through the Medicaid.
It's our Medicare, I mean, it's our Medicaid cost.
If they're in a nursing home, yes. If they are in the community still, it would be Social Security generally. And so we also have rep payee cases. There are many more rep payee cases where there were 28 throughout the year in 2024, where there is a caseworker actually managing the Social Security spending the funds and keeping people in the community and paying their bills for them also.
And there are two different types of guardianships. There's guardianship of person and guardianship of property. There may be situations where the person is capable of making their day-to-day decisions, but can't handle the financial aspect of it. Although usually 99 times out of 100, when you're appointing a guardian, it's usually both.
When they take a home, and the nursing home will actually take a home, person's a resident at some point. Just you handle the sale of that too, right? Or no?
We only had one of those recently.
The prevailing thought for anyone who is going to enter a nursing home is that their home will then be taken by DSS. That really does not happen. It would put a lien on it so that when it is sold, the county would pull back funds from it. The nursing homes, by and large, are very hesitant to ever collect the funds directly themselves. They put that on us. But I am guardian for someone right now who is attached to several properties. One of them pretty magnificent by Washington County standards. And yes, we have had to work through the sale of that. Areas of the world that I would have never anticipated as a DSS commissioner.
Right, that's new as of the last few years, that's happened.
It's becoming more common of the last few years.
That's another one where the person's actually in a nursing home in Columbia County and was last a resident.
Yes. So all of the petitions that we file do go through the county attorney's office, and you'll see that there were 6 abuse petitions filed, 37 neglect petitions filed. Those would all have started out as a child protective investigation. That may be 1 child protective report, it may be 10. But it's us working through the authority that we have from Child Protective. We have had a couple of opportunities to file for applications to get access to the home or the child. That's usually the last resort, because we try to be as convincing as possible to let us talk to the children or let us see inside of the home if we think that there's a safety issue. The permanency hearing reports are something that have to be filed, I think, every 6 months if a child's in foster care.
First one is at 8 months when a child is in foster care, then every 6 months thereafter.
So that would be ongoing throughout the time that a child is in foster care.
Or adopted.
Or returned to their parents.
Yes.
The little snapshot that's in the middle with the umbrella, that is currently the face page of our foster parent recruitment, Facebook page. So I would ask you, if you are on Facebook, to give it a like and share it. We put through an awful lot of very good information on that on a regular basis. It's kept very lively to share information, to try to debunk some of the myths that are out there related to what it takes to be a foster parent, but then also a lot of supportive articles around child rearing or supporting families, that sort of thing. This is an area that we have expanded upon. The outreach in general for our foster parent recruitment has expanded largely over the course of the last year, and I think it's doing very nicely. We're getting good information out there. Quite recently, there was even one of our ads that were seen in newspaper, happened to be on the same page with the chairman's article.
Oh, boy.
And he was asked about our foster parent recruitment.
And I didn't know the ad was there.
Well, it wasn't right.
Well, it was effective, I got it.
So we're still working on it.
Back on the legal. That doesn't, 100 doesn't drive me nuts. Is that a normal year? Is that way high?
We, at times, years ago, were a lot higher.
Well, that's what
I would say maybe slightly higher than average. I think we're with usually between 70 and 90 usually. I'd say probably the average.
And so pretty much, saying that I'm the person of last resort, we are the agency of last resort. The systems that we use are, generally worst case scenario. When you get to this point, you need to provide for any situation. So we do everything we can to avoid the legal process, everything we can to avoid placing a child in foster care. So sometimes we're able to seek out the supports that are needed, and sometimes we have to go through the legal process.
Yeah, I thought you were gonna throw Dan into the box and say we go to the lawyer of last resort.
No,
But you didn't do that.
Yeah, that's for all of you.
I'll share. The chart that's underneath the one with the umbrella, benefits paid out by program, just more information about these programs that you hear me talk about. The temporary assistance through TANF, which is temporary assistance for needy families, temporary assistance through safety net. That would be the people that do not have children with them in their family unit or have received benefits for longer than 60 months. SNAP, which is the Supplemental Nutrition Assistance Program, HEAP, which is the Heating Emergency Assistance Program, and daycare. That ended up being over $25 million of benefits that went out to the residents of our county through those programs. HEAP, when we talk about HEAP, we often think about strictly what fills the tank at the home, whether it be propane or fuel, or if they burn wood or use electric. But there are other parts of the program as well. They are usually a window of time that they're open and available. But the furnace replacements, you'll see that through the federal fiscal year, there were 26 cases for a total of $155,730 of furnace replacements that were done for residents of Washington County. And this must be someone who owns the home or has some sort of ownership status. We wouldn't do this in an apartment building or anything of that nature. And then the same with the furnace repair estimates, the clean and tune, and the cooling capacity. The other charts, again, are there, the bar graphs to highlight the areas that we have talked about as having been so incredibly expensive and having such higher costs in 24 than had been previously experienced. In CSE, down in the bottom left-hand corner, I want to just share that the difference between the purple bar and the green bar, the purple bar being what is paid out to the facilities and the green bar being the DSS net expenses, the rest of that would be in part what the school is paying us or something that is not reimbursed, but that would be the area, the difference in that. And it was interesting to me that our accounting folks were able to pull the chart that's right next to it to show where over these last few years, these students have come from. So that would be an indication of their home school district. And it gets a little funky the way that the name of the town comes down, but Argyle had placements over the course of 4 years. Cambridge did just during the 23-24 year. Granville did in 23-24, and then one past year. Hudson Falls has all of the years for this look back. Salem did for 2 years. Whitehall did not have any recently, but had in the past. Would like it if you would take some time to flip through this report. It is not a sad moment for me to say that this is my last letter in an annual report. I always think to myself that I should write it right at the end of the year so I can reflect on that year without losing track of it. But I had no chance of losing track of 24 this year so far. So it's stayed fresh enough for me to just pull that together recently. There's a lot of other information there. If anybody has more questions on what you see in here, or if you hear, let me know. The offer is still open if someone would like to shadow a staff member in any particular program within my department. Those are all the programs.
Well, any questions before we release Tammy?
Thank you. I just want to point out also, if you look inside under child support, number of petitions filed, 707, that's something my office handles as well.
Yeah, I wonder if that maybe it's something you want to add to that initial legal services line, because we don't have that. Oh, I'm sorry, we do down here, child support certificate. Yep. I just left it on.
Oh, and you mentioned, we talked a little yesterday, and I don't know if anybody else gets this sense. This feels like a church bulletin to me. Are we here for religion too?
Just like with religion, there are a lot of things you don't understand. You just need to.
Just take it as faith.
Yeah.
There's a lot of faith between these covers.
Thanks a lot.
Thank you.
I'd like to thank Tammy. Tammy, you've served all over the years. I mean, I know I've been pain in everyone's side about this budget, but this is gonna drive me nuts, and there's no good way to fix it because we have no answer. Eventually, next year we'll know how this year turned out. I mean, that's where we're at.
And I will be able to bring to you some budget comparisons, certainly before then, and before I depart off into the sunset.
No, I'm just saying for the job you've done. I mean, I know your heart's been in the right place, and you've served as well, and I appreciate that as much as anybody.
Thank you.
Is there any other business that wants to come before the committee today? And we are adjourned.